My name is Leonard Lee. My title is Associate Professor of Surgery within the medical school, and my title within the hospital is Chief of Cardiothoracic Surgery within the Department of Surgery. I went to Robert Wood Johnson Medical School. After medical school, I did 5 years of general surgery training at St. Vincent's Hospital in Manhattan. Afterwards, I did 2 years of research fellowship in one of the labs at Cornell, and what we looked at was gene therapy, utilizing a virus that no longer functions like a virus, but can carry DNA into a cell, reprogram the cell to then do what we want it to do. And what we were growing were blood vessels on the surface of the heart, and what we called it was biologic bypass. So I did that for 2 years' time, and then after that I did my further training in cardiothoracic surgery for an additional 2 years. My areas of interest are all of cardiac surgery, which is surgery of the heart and all the great vessels that come off the heart to the rest of the body. But within that, my particular areas of expertise are minimally invasive valve surgery, and that is operating on the valves of the heart through smaller incisions. Traditionally, we had always used a midline incision, or what's called a sternotomy incision, which is an incision right down the middle of the chest that divides the breastbone. In minimally invasive valve surgery, we use alternate routes to get to the heart or to get to the valve, and utilizing very small incisions. The advantages of minimally invasive surgery is that overall recovery time for the patients can be shortened, and they can have a sooner back to work time. Being at the Robert Wood Johnson Medical School, I have two sets of duties, really. One is clinical, which is the taking care of patients, operating, trying to grow volume, quality measures, all those types of things. My other duties are educational and are to the medical school. I'm responsible for research within the cardiac surgery department, again, trying to bring forth all the cutting edge technologies, trying to move cardiac surgery research forward into the clinical arena. The other part is also education, and educating our doctors of tomorrow, who are the medical students and the general surgery residents. We also have a training program in cardiac surgery where we have fellows who come here after their general surgery training to learn how to become a cardiothoracic surgeon. That means we can tackle any problem that may arise with anyone's heart, whether they need a transplant, whether they need what's called an assist device or LVAD to get them to transplant. We can deal with thoracic aneurysms, as I've stated, coronary artery disease, aortic valve problems, and basically any problem you can think of that deals with the heart or the great vessels of the heart are things that we're poised to fix. What I'm excited about being at Robert Wood Johnson is that we are able to take care of the sickest of the sick heart patients.